If heart disease has taken away the little things your loved one used to do without thinking, your family may be wondering how much more you can manage. You do not have to wait until the final stage to ask whether palliative care and possibly hospice could add support. Hi, my name is Rupal. I am a registered nurse with experience in hospice and palliative care, and I help families understand care options during serious illnesses. So today we're going to talk about cardiovascular disease, or CVD. It's a broad spectrum of diagnosis. It can include congestive heart failure, coronary artery disease, peripheral artery disease, ischemic heart disease or heart attack, cardiomyopathies, and more. Often more than one condition is connected. One person can be living with more than one of these diagnoses all at the same time. So let's look more closely at heart failure today. The New York Heart Association describes 4 classes of heart failure. Class 1. There is cardiac disease but no symptoms or limitations with ordinary physical activity. The heart structure may have changed a little bit, but there is no heart failure symptoms. The person is living an ordinary life and does not need extra support. Class 2. There are mild symptoms and slight limitations during ordinary activity. For example, high blood pressure or high cholesterol can lead to plaque buildup in the arteries, causing shortness of breath and fatigue with strenuous activity. The person may slow down and start to feel the burden of the disease. Class 3. There is a significant limitation in activity because of the symptoms, and the person is comfortable only at rest. At this stage, is it appropriate to ask about palliative care? Absolutely. Class 4. There are severe limits on the activity, and symptoms are still present at rest. They do not resolve with rest. This is considered end-stage cardiac disease according to the American Heart Association and may require specialized treatment strategies. At this stage, ask about hospice care because the person would most likely qualify and benefit. In the United States, approximately 2,000 patients die every day from cardiovascular disease. But the burden is not only the numbers. The symptom burden can be a huge issue. A complicated medication list, also called polypharmacy, and a complex treatment regimen can affect quality of life for patients, families, and the healthcare team. Advanced heart failure symptoms can include shortness of breath and fatigue with or without activity, fluid buildup, especially in the lower legs, arrhythmias and associated defibrillator shocks, organ dysfunction that requires dialysis, thrombotic complications, depression and anxiety, all of this. The physical and mental distress can leave patients and families worried and stressed. They may carry the burden of symptoms that do not feel relieved. This is where a hospice team can help manage those symptoms differently from your cardiology or primary care doctor. The American Heart Association's 2025 scientific statement related to cardiovascular disease recommends palliative care throughout the heart failure trajectory to help with the symptoms and improve quality of life. If you're seeing a growing symptom burden or major limits in everyday activity, it's okay to ask what additional support may help your loved one and your family. You are not giving up by asking that question. You are asking for support. If this helped, share it with a family member or caregiver who needs to hear it. And subscribe. I post every week. In our next episode, we will talk about what a hospice team can do for someone living with congestive heart failure. See you in next episode.